Digital health. You hear that term constantly these days, don't you?
All the time.
But sometimes, well, it feels a bit empty. Like a buzzword that promises the world, attracts investment, justifies changes.
But isn't always clear what it actually is.
Yeah,
I get that.
exactly.
So that's really our mission today. Let's try to cut through that buzz. We want to really unpack digital health as an analytical concept.
Okay.
And we're going to lean on insights from this really interesting paper by Marent and Henwood. They use what's called a sociomaterial approach.
A sociomaterial approach. Okay, sounds academic. Can you break that down a bit?
Yeah, absolutely. So think of it this way. Instead of seeing tech over here and people over there,
Right, separate things.
this approach says no, they're deeply interwoven. Technology and human practices, they constantly shape each other. It's not tech plus people.
More like tech and people dancing together.
That's a great way to put it. Yeah, a constant dance. It really challenges that idea that they exist in isolation.
Okay, that makes sense. So this lens helps us understand how digital health is fundamentally changing healthcare.
Exactly. And the paper highlights 3 big areas being reconfigured: how we gain knowledge, how we relate to each other, and how control works.
Knowledge, relationships, control.
Got it. And what's really key here is this idea of dynamic intra-actions.
Mm-hmm.
Things like an app or even a patient. They aren't static. They sort of emerge together through how they interact. What really matters is how these technologies come to matter, how they become meaningful through actual use in real practices, and how we make choices, or agential cuts, as they call them.
Agential cuts.
Yeah, it just means the boundaries we draw, the decisions we make that shape what digital health actually becomes. Like, look at the FDA. Their definition of a digital health device isn't fixed anymore.
Oh, how so?
Well, they're shifting from just looking at the product itself to considering its intended use, even the whole company's culture.
Really? The company culture.
Yeah. It means they can sometimes simplify approvals for, say, lower-risk apps, but it demands a lot more monitoring after release because they know these things evolve.
That's a really different way of thinking. Okay, so let's dig into those 3 areas. First, knowledge. How do digital tools change what we know or how we know it? It feels like everything's being turned into data, right? These bit strings.
Precisely. And it's so important to understand that this data isn't neutral. It's not raw like we might think.
Right.
The paper calls them contingent matters. They're created, they get their meaning from very specific situations and practices.
Can you give an example?
A really powerful one is in reproductive medicine. This concept of in silico vision.
In silico, like
Yeah.
computer vision.
Basically, yes. It's about using automated time-lapse imaging of embryos combined with algorithms and huge data sets to predict viability. And it can see things, patterns, that a human embryologist simply can't detect visually.
Wow.
It creates a whole new kind of authorized seeing, a new standard for what counts as a viable embryo.
So the machine's view is becoming the authoritative one in some cases.
It really is. And that has huge implications, not just for IVF success, but for how we think about prenatal life, how it's commercialized.
And it also creates new roles for patients.
Definitely. This idea of digital health citizenship emerges, where patients might have new responsibilities, like maybe donating their data for research becomes part of the deal.
Okay, so that's knowledge being reshaped. What about relationships? That human connection is so central to care. How does digital tech change that?
That's a huge one, especially post-pandemic. We saw this massive acceleration of what the paper calls escaped medicine.
Escaped, meaning care escaping the clinic walls.
Exactly. Care delivered anywhere, anytime, thanks to digital connectivity. But it's not always simple.
Right, I can imagine.
Take studies on HIV care platforms. They found asynchronous communication messaging back and forth could create real support, this feeling of distance presence.
So connection despite the distance.
Yeah, for some. But for others, maybe newly diagnosed patients or those who were sicker, there was this strong need expressed for corporal presence.
For actual physical closeness.
Exactly. The human touch, being in the same room. It raises really important questions for all of us, for you listening. What happens to privacy when patients become less visible physically, but incredibly visible through their data trails?
That's a tricky balance. Okay, third area, control. How do digital tools with their speed, instantaneous calculation change how control operates in healthcare?
Well, that speed allows for control to be distributed in new ways, shared between humans and, well, non-humans.
Like algorithms.
Precisely. Think about physical rehab. You might have your smartphone, an app, maybe some sensors. These algorithmic systems can act almost like a virtual physiotherapist.
Giving you feedback in real time?
Yeah, corrections on your exercises, tracking progress. But what's really interesting is the algorithm isn't acting alone. Its agency, its power, comes from being linked up with lots of other things.
Like what?
Policies, the IT staff maintaining the system, the patients themselves who figure out how to use it, or even work around it sometimes.
So the system isn't just imposed, it has to be kind of worked with.
Absolutely. It often needs adjusting and creative repair in practice. It shows control isn't just top-down, it's negotiated, it's distributed. And that pushes us to think about accountability differently beyond just looking for bias in the code.
That makes sense. It's much more complex. So we've looked at knowledge, relationships, control. What's the big takeaway here for the future of digital health? Where do we go from here?
Well, the paper suggests three really helpful strategies for guiding innovation responsibly. First is embracing genuine participation.
Getting diverse voices involved.
Exactly. Not just tokenism, but real co-design.
Yeah.
Second is understanding affordances.
Affordances.
Meaning what a technology makes possible isn't inherent in the tech itself. It always depends on the user, the context, the situation. It's relational.
Okay. And the third?
Recognizing generativity. The idea that digital health isn't some finished thing we're implementing. It's an open-ended process, constantly unfolding, constantly being reshaped by how we use it.
So this deep dive really shows us digital health isn't just tools and software. It's this living, breathing thing tangled up with the very meaning of care.
Yeah, absolutely.
And it really challenges us, doesn't it? It makes you think, how can we, all of us, consciously make those agential cuts, those choices about technology, to build the kind of care we actually value in this increasingly digital world?